So if the disease is severe and there is some risk of stroke in the future, generally you will see a surgeon who will talk about the different options for treatment. And some of those treatments are medications like cholesterol medicines and blood thinners like aspirin or Plavix. But there are some procedures that can be helpful to reduce the risk of stroke in the future. One of those procedures is the carotid endarterectomy, which is an open surgical procedure where the surgeon actually cuts the cholesterol plaque out of the artery. But there are also less invasive procedures that can be performed where a stent can be placed within the artery. And the benefit of those newer procedures is that they are less invasive. So the benefit to the patient in that regard would be less postoperative pain and a smaller incision and a faster recovery. So the TCAR procedure is an operation where the surgeon makes a small incision just above the collarbone. Basically, he then inserts a small needle into the artery, and through that needle hole, he puts a stent inside the artery. The benefit of doing the TCAR procedure, however, is what's done during the procedure to prevent a stroke. And what's done there is a small tube is run from the neck down to the groin to an IV, and then the surgeon creates a reversing of the blood flow in the carotid artery so that the blood is flowing away from the brain. In that case, when the surgeon introduces the stent or does some ballooning inside of the artery, if any particles break loose inside the artery, those particles will be removed from the body through this tube instead of going towards the brain. And really, that's the biggest benefit of this procedure to the patient. Well, introduction of the TCAR procedure really has opened up more options for the patients. It's a hybrid procedure from what most people would consider to be open surgery or just a stent procedure. It's kind of the combination of the two, and it really provides the best of both worlds in one operation. As a surgeon, the more options that you have to offer patients, the better you are as a physician. And being able to offer the patient traditional open endarterectomy, transfemoral carotid stenting, and TCAR really gives you the best of all worlds. And in that regard, you can always offer the patient the best procedure for that particular person.